Had a lot of questions about our FAQs. I want to speak briefly to that, and then I'll answer after the doctor speaks. I'll answer questions about the safer at home order and how it applies to various businesses. All right, so let's start off, and we've got an FAQ for all of you, frequently asked question sheet for all of you. What can I do? You can perform tasks essential to your health and safety, or to the health and safety of your family or your household members. For example, obtaining medical supplies or medication and visiting a healthcare professional, going to the grocery store, obtaining supplies needed for work, and that's not an exhaustive list. Those are just examples. And obtain necessary services and supplies for yourself and your family or household members, or do those services or supplies to others, like food for pets. You can work at an essential business. You can care for a family member or pet in another household. You can engage in outdoor activity as long as you keep 6 feet between you and other persons. And you can move to another residence either in or outside of Dallas County. Now, you'll have a lot of questions about what you can't do, but I think it's just easier to tell you what you can do. If it's not something on the can-do list, you can't do it. What is still open, and again, we'll answer some more questions, but government services like police stations, fire stations, hospitals, clinics, healthcare operations, jails, certain courts, garbage and sanitation, transportation including DART and Uber, and all taxis and ride-share services, and utilities such as water, power, and gas. Healthcare facilities, including hospitals, clinics, dentists, chiropractors, offices, optometry offices, pharmacies, healthcare supplies, mental health providers, substance abuse service providers, and blood banks. And that is not an exhaustive list. But remember, on the healthcare services, if you're going to the optometrist to get a new pair of glasses because you don't like one of the several pairs that work for you that you have now, that's not an essential trip. If you can't see, I suppose it could be, or if you had eye surgery and you need a checkup, that could be. Similarly, you want to limit trips that even to these doctors. Anything that is elective is not permitted. Okay, food, and when you think of food, anything in the food supply chain, drive-throughs, delivery from restaurants, takeout, grocery stores, the factories that service them, all those things are essential businesses. Schools, only for the purpose of facilitating distance learning and performing essential functions. By the way, that includes feeding people, and so if you're in the food supply chain, then you're exempted to the extent you need to do that. Maintenance services, so think anything that you need at home to maintain cleanliness and function in your home. So plumbers, HVAC, lawn mowing services, both for business and for residences. Swimming pool cleaning. People may ask me, well, why are we cleaning swimming pools? Remember West Nile virus. There are people that don't know how to clean their own swimming pool. We can't afford to have two epidemics at once. Let's see what else. Cleaning services at essential businesses and within the home. Animal services. Anything you can do for a person, you can do for an animal. You can buy products for the animal. Okay, let's talk about financial institutions. We had a lot of questions about financial institutions today. A financial institution that can remain open is a depository lender, as that term is defined by the FDIC. So if you are not a depository lender, and I cannot even come up with all the list of companies like this, but if you're, for instance, a payday lender, you don't take deposits at your business, so your business is closed. Anyone's business is closed can work from home. Laundromats, any sort of laundry service is open. Cemeteries and funeral services are open. At cemeteries, you must maintain 6-foot distancing. So if you're in a room this size, then you've got to maintain 6-foot distancing, and that controls how many people are in there. and we'll talk more about those. A big question, what about childcare? Childcare is for essential businesses. If you're not in an essential business and you're working from home, and I know it's hard to do that with small children at your feet, but what we're trying to do is limit the groupings of people. We've got regulations in here that I won't read because I want to get to the doctor for those children that have to still be in childcare. But those are for essential businesses, not for everyone. We talked about Uber. A lot of people are asking, how do I prove that I am allowed to be outside? And again, and I guess by that, when people are asking that, they mean driving around in their car. At this time, there's no requirement of proof that you're allowed to be outside of your residence, because the order presumes that residents will adhere to their civic duty and follow the orders for the greater good of the community. If it is clear that you are not, then we will have to step in. And with that, again, we will answer your questions about the control order. But first, we've had people understand this, right? We've had a lot of people that say this is an overreaction. Well, these are state numbers, or you're just reacting to what happened in another place. So I thought it would be helpful to have a local doctor who does not work for the government come and address us. So I have asked the president of the Dallas County Medical Society, Dr. Mark Casanova, to lay out for you the current situation here in Dallas County. Doctor?
Thank you, Judge, and thank you for allowing me to be here and address everybody today. My name is Mark Casanova. I am a physician, internist, and palliative care doctor. I'm the president of Dallas County Medical Society, represent 8,400 physicians in Dallas County, as well as the subsequent tens of thousands of care team members who we work hand in hand with. If you ask what can get 10 doctors and 10 hospitals to agree on anything, it would be a pandemic and the situation we're facing right now. We have been preparing for this dating back to 2005 through Dallas County Medical Society and our partners in the hospitals in North Texas to envision what might a pandemic outbreak look like in North Texas. Every rabbit hole that we explored always brought us to a similar recommendation. That similar recommendation in the various pathways was a stay-at-home order, shelter in place, safe at home. And the reason for that and the importance of it, and what I want to relay from the healthcare perspective, both practicing physicians in the hospitals, in independent clinics, nursing colleagues, is that what we need in this fight is space. Okay? Treating a viral illness and managing a pandemic, while they seem very similar, are in fact two different things. Physicians and nurses will treat the viral illness. We will care for those patients who are desperately in need. Elected leaders and public health officials are the ones who assist us and aid us in managing the pandemic. Right now, we are waging battle with sticks at best, and we need swords. Our public officials, by making very difficult decisions they are faced with making, provide us the armor and the shield we need. And what do I mean by space? It's been widely reported that when we look at ourselves here in North Texas, the data, the numbers that we're assessing are really 5 to 7 days behind the curve. So what we do is we look at places that are approximately 5 or 7 days ahead of us. And we ask ourselves, is this what we're going to look like at that period of time? We have the space. And the analogy I would use is dominoes are falling behind us. And I'm hearing them over our left shoulder about 2 dominoes back. If we can stay at home and stay safe, we can remove 1, God willing, 2 dominoes and provide us the protection we need to more effectively handle this on a population basis, but then also more effectively care for the patients who are becoming critically ill and entering our hospital systems as we speak. So on behalf of organized medicine, I do want to commend all the elected officials and acknowledge the difficulty decisions they're making. These decisions are not binary like most are. Vaping is bad, not vaping is good. It's clear. Decisions that we're faced with are linear, and it's measured on a scale of badness. Okay? Situation is bad, we make a decision that makes some matters worse. Means that folks can't go to work. Means they've got to figure out, how do I care for my child? Not acting takes us down the scale of badness. So I want to commend the leaders who have made extraordinarily tough decisions, analogous to the decisions that we make on a clinical basis. It's also been widely stated, and I firmly believe this, that we're all in this together. Every one of us is partners, and I would actually take that one step further. I would state that every one of us, every one of you in this room, everyone at home watching, are now deputized care providers. Okay? And we all fall into three categories. We have the lifesavers, the life supporters, and the life protectors. The lifesavers are men and women, are my brothers and sisters who are in the trenches right now, handling the patients that are influxing into our hospitals with coronavirus, but at the same time, our family members who are having heart attacks, our patients who are undergoing cancer therapies, our individuals whose gallbladder goes bad and they need an urgent surgery. Health conditions don't stop for a pandemic. It's our first responders, and I would contend it's leadership at the county health department, at our county judge, and so on. We've got the life supporters. Okay, Judge already spoke to many of those. There are grocery stores, there are delivery chains, there to ensure that your plumbing can be fixed if need be. They're my 11-year-old daughter's school teacher who sent them homework today, or classwork. So thank you for that, by the way. We needed to keep her busy. And then we have the life protectors, and the life protectors are everybody, okay? They're the ones who are taking responsible action, understanding the sacrifice we've asked of them, and are staying home and protecting others. So we really need that shield. We need that space. And I want to thank you all for being care providers and doing the best we can to manage this. Thank you.
Thank you. And with that, we'll take your questions, and whoever the question's for, come up. Let's all try to keep a good 6-foot distance. Go. What's your first question?
Judge, a lot of people, our viewers, were asking, some of them don't even know what county their city is in. Do you think you can provide a list of the cities for our viewers? And with that, they're also asking, do I have to go to work if I work outside of the county?
Okay. If you live in Dallas County, you're under this order, and so it's a safer at home order, and so you can't get up from your house in Dallas and go to another county to work and come home at night. We are allowing people to move out of the county, but I suspect that very soon the rest of this region will likely be doing the same thing that we are doing, so that really won't make much difference. As far as, unfortunately, I can't give you a list of cities that would answer it, because, for instance, the city of Dallas is in both Collin and Dallas County, and the city, there's only a small amount that's in Collin County. The city of Carrollton's about half in Dallas and half in Denton, and we have several cities like that. Some cities, like DeSoto, are completely in Dallas County.
Judge, recognizing that this is a fluid situation, do you have any idea how long you'll be asking people to do this?
You know, I really don't. We're gonna. It's a unprecedented situation, so we're watching that situation closely, and we'll, just have to, as a community, do it together until it's safe to stop doing it.
You have no estimate, no.
The estimate from the medical community is not 2 weeks. It's months, unfortunately. I hope that turns out to be wrong. There's so much that's unknown, Andrea. For instance, is it like the flu? When it gets warm, will this thing wane? We hope it does. By us doing this early, we stand a much better chance of it being a shorter situation than if we were to let this rise and rise. By the time you see it explode in your community like it's doing in New York City now, it's never too late to act and follow science. But at that point, you're looking at a much longer epidemic than you are when you act early. That's why we're trying to flatten that curve just as early as we can.
Are you at all concerned about the availability of N95 masks at Parkland in particular?
Yeah.
We're hearing that there's some concerns about shortages.
Very much so. So I believe Dr. Casanova had told me that, Doctor, can you speak to when we'll be out of masks if people don't step up and start making masks for us, and we can't.
I mean, I think what we can say is, in many of the institutions, I think they'll want me here. Many of the institutions are actually tracking with each other. So when we listen to the national news and I hear the situation in Illinois or other locales, we all seem to be on the same general time frame. If we change nothing, many hospitals run the risk of exhausting appropriate protective equipment by mid-April. Okay, so that's a short time frame, and we got to realize that we want it at Parkland, we want it at all our sister institutions in North Texas, and so does everybody else across the U.S. So I think that's one of the many challenges we're facing.
Dr. Casanova, while you're up there,
Yes,
can I
ma'am.
ask you, you talked about the data that we have here is really reflective of 5 days ago or whatnot, and so you're looking at other locations to try to gauge what's happening here at this moment.
Right.
What are the other locations you're looking at that you feel like could be Dallas County 5 days from now?
We're looking at the major metropolitan areas. So you got to sort of compare to a certain degree, as best as we can, apples to apples. Now that gets really difficult. So we're looking at the major metropolitan areas. We're looking at Seattle, which is pretty far ahead of us at this point, New York and the others. We would hope that other locales and municipalities are looking at Dallas. I think we have to acknowledge that there are a lot of unknowns, not just about the virus itself, but a lot of unknowns about what's the penetration rate in a certain community or locale. The positive is that 80% of patients do well with this. The downside is a good chunk of that 80% are going to be asymptomatic and so unaware of the spread. So when we talk about number of cases and whatnot, those individuals acquired the virus anywhere from 5 to 14-day range prior to that. So when you hear about numbers jumping, you've got to understand, okay, well, there was a spread going. So then we can extrapolate it and look forward and say, where might we be if we don't change anything? To the judge's point, we can affect this, and it's the collective we, not just doctors. We are feverishly working on what treatments are available, how to best support these patients when they become that critically ill. But we can change those numbers. We have the ability. We can, and we've seen it in other countries and other locations where that curve just takes a sharp right turn, and that's what we're shooting for.
Doc, knowing what we know right now, is Governor Abbott making a mistake in not ordering a statewide shelter in place? I
can't speak to that or the governor. I think every state governor, every locale is going to need to assess this. I understand that we have a mammoth state, and but I think what I'm focused on are the patients that I have the ability and my colleagues have the ability to serve. We care about everybody, and we hope that others will look at this and look at those that are 2 steps ahead of us and understand that if we can just remove those dominoes, we stand a chance to really make a meaningful impact. So there is hope, and there is room for positivity here.
Clay, can you kind of answer a little bit more about the shelter-in-place order tonight? A lot
Sure.
of people know what you can do. You can go to the grocery store. You can, travel, to another residence in the county. You can help people that are in your family who might need it. Are you concerned that people are going to use those things as excuses to just continue to just walk around and do whatever they like? And what would you like to tell those people?
Okay.
Just because I've heard a lot of people say, well, what difference does this make?
Okay.
What is it different from what we're already doing?
Okay, so I'm going to repeat the questions in case I don't know how the audio works in here. So what Matt was asking is, what about the people that will use the excuse of going to the grocery store or other activities to go do things that aren't essential? Well, we will certainly hope that people wouldn't do that. And we need to police ourselves, all right? Because here's what we're looking at as a first responder community, okay? We know that our first responders will be the people who go and touch those who are sick, all right? Will be the people that have to stay healthy and power through things to keep you safe. And when you have situations of uncertainty, good rises to the top, and many people do heroic things, but evil also rises. And so we need our first responders to focus on that evil and focus on protecting people who need intervention and health interventions. We need you to call, I believe it is 211. I always get it backwards. It's 211 or 311, but it's 311. Somebody reminded me. Call 311. I hate to say turn in your neighbor, but and also talk to people when they're not doing social distancing out there on the trail and around the neighborhood. Just give them a friendly 6 feet. If they just keep doing it, give them a not so friendly 6 feet. But because it's not endangering just them, it's endangering all of us. On these calls of what do we do? I'll give you an example. So you've got a parent at home who's working to feed their family, and they need to be able to concentrate, and they have 2 small children that are wrapped around their feet yelling, and the only way to really get anything done is for somebody else to take care of that child, but there's no one to take care of the child. So why can't we make an exception and send those children to child care? Because every grouping carries a risk, right? And so we've got to, if Safer at Home is going to work, we have to only have the groupings necessary to keep you safe and to keep the supply lines open and to keep the healthcare system open.
Judge, our viewers would like to see a translated version of the order in Spanish. Are you guys working on that, or what can they expect? Yes.
So the challenge is actually a friend of mine who's a lawyer is working on that. Now remember, it's an order, okay? So where the translation varies, if it does, then the one that controls is actually the one that's in English. But we will get you that. I don't know if we'll get it today or not.
Judge, with respect and understanding for the Safer at Home order, I wanted to ask for some clarification. When you called for the shelter in place last night, you showed some data that some leaders in the state have reached out to us and said that they viewed as extreme. Without a shelter in place, more than 70% of people will be infected. Without a shelter in place, hospital beds will be at capacity by the end of April. How did you and your team vet that information? And
Sure.
do you know where they got their information from?
Sure. I tell you what. So I had told Phil, Dr. Wong, who, by the way, is just a tremendous leader, and we're blessed to have him. So, Elisa, could you go get his poster? I told him, this is just way too much information for one night. The point of bringing a doctor, but we're going to give you some local conservative data. If you say, well, that just seems too extreme. All of these things are just guesses, doctor-educated guesses, because it's a novel, new virus, and these aren't peer-reviewed papers that you'll get 2 years from now. These are the best guesses of a situation on the ground where we don't even have visibility to what's actually happening until a week or so later. So I brought you a doctor that is the president of the Dallas County Medical Society to let you know where the doctors are. And we've got this very conservative numbers compared to the numbers for last night that he has. And when the poster gets here, I'll let him go through that with you. But again, no one's guess. It's even more so than Vegas odds of a basketball game. People trying to pick who's going to win the tournament and by what score. Nobody is going to get it exactly right. But what they all agree on, what every scientist here, the DFW Hospital Association, the Dallas County Medical Association, the palliative care doctors that will treat the dying who can't be helped, the infectious disease doctor that will treat those who can be helped, they all agree that we need to act now. And so we'll come back to that when Elisa gets her alternative to Phil.
What would you need to see to lift the Safer at Home order? What would
I would need to see a recommendation from the medical community that it is safe to do so.
Is that just a decrease in cases that are
Well,
coming in, or what would that take?
Well, honestly, and I don't know if you can hear that, Matt's asking me what it would take to lift the Safer at Home order. And, I'm at peace with the fact that this is not a time for politicians and elected officials to try to come to some consensus on their own. It is a time for us to listen to scientists, both on the federal level at the state health department, our public health authority, Dr. Huang, and the local doctors and hospitals. And then when we get that data, it's time for us to act on it swiftly and give them their best chance to protect you. So if they were to come to me and say, Judge, you can loosen this order, nothing would please me more. All right.
I wanted to get to the number of tests. Since you've lifted the age restriction, do you know where we stand on that? I know it doesn't close until 8 p.m.
No, I don't.
Is it 250 tests per location? 250 tests
It's
per
250 tests per location that the feds will test each day, yes.
I'm hoping this isn't the case, but what do people do if their employers, not essential, are telling their employees to still come to work?
Well, gosh, I certainly hope that that's not the case too. I tweeted a response to someone today. Show your boss the order and explain to him that this order is binding and it's punishable by a fine on the company. And the company may say, well, gosh, I don't care about the fine because I'm losing so much more money each day than a fine. But it's also something that we'll look at in code enforcement to take you to court, to take away your certificate of occupancy if that's what it takes. And further, I can't think of anything that would be worse for a business than for the press to out businesses that are staying open with this public health order. Look, I get it. I own small businesses still. I don't. I'm focused, obviously, pretty much 24 hours a day now on this when I'm not sleeping for 2 or 3 hours. But I get it. Small businesses. We are going to lose a lot of money. Okay, I get that. It's going to be painful. And people in small business, they're risk takers, they're job creators. I hate that. And I also have a lot of friends who work at small business and big business and all kinds of business, and I hate that too. But we have to put the life of our people above our livelihood. That sounds trite, and I don't mean it to be trite, but the first thing that we have to do as a community is protect one another.
So following up with this question, this doesn't require the companies to completely shut down and send their employees home?
You can still work from home. And
But
if you,
they cannot work
Sure.
from home, like they're building beds or something like that, which
Yes.
it's real, people have right
Sure.
these things.
So if they're doing a non-essential job that's not covered by these orders, then unfortunately and sadly, they're not going to be able to continue to work during this time.
And
What
could you
if
talk
they-
about,
And they finally, why don't we set the charts up for Phil?
What if they are making them go to work?
Well, again, help. This is something the media can help and neighbors can help us with. If that's happening, I hope we'll all help bring that to the attention of the public, and I think that'll be very, bad for their businesses. We have worked with the federal government, the state government, and many other, in the supply chain, the healthcare chain, to have the most liberal order as far as what is in for for people of anywhere in the country. What I told my team that put that together is if anyone else is allowing it to begin with, put it in there. And then we'll review it, we'll watch how things are going, we'll see how the movement of people are. We may take some things out. But you've already got an order that is that allows for things like liquor stores, okay? And it's in there because it's in 8 other orders. But if you're not in there, you're not in there, and I'm sorry about that. And if you violate it, then we're going to out you, we're going to fine you, and we're going to take the steps necessary to shut you down because what you're doing is not safe. And
what do you say to the person who lives in Dallas County but works in a county where a shelter in place is not in order. Do you go to work?
If you should show your boss the order and explain that you're a Dallas County resident, and if you were to do what they're asking, if that's what they're asking, that you'd be in violation. And if you were turned in, I think, you know, I hate to say that I want people to keep an eye on one another, but we all do need to do our part to save lives here. If you're found out to be doing that, then you know will be fined, and again, I think your company will bear the brunt of a lot of public disapproval if it's found out that they are forcing their employees to break the law. And it's a tough situation. It's tough for these businesses.
Something like that would end up in court then, just to understand.
Well, yeah, you'd start off with a fine, and then they would also be taken to court.
You have talked about fines. I believe you said $2,500 for the businesses.
I think it's actually I think it's less. I think it's yeah. I think
Can you explain the difference?
it's 1,000. The lawyer says.
1,000 for a business, and a person, let's say someone, it is confirmed to be doing non-essential activities. What are the differences? Let's say a person is detained, and it's what would be the fine for a person, a common person?
Oh, again, yeah. I think the question is what would be the fine for a common person who violates the order. It could be up to $1,000.
Okay.
All right, and we are going to be in the business of protecting you from violent crime and providing needed life-saving service in the coming weeks. And we don't have enough manpower to do that and to follow you around and be the curfew nannies. So we need everyone's help. Okay?
Judge, just quickly, because this question was posed to the doctor earlier, and keeping in mind that you have been asked to name the cities because people are having trouble trying to figure out which city they live in, county they live in, which county they work in. What are your feelings on sort of the continued absence of a statewide shelter in place? Has there been any movement on that?
I think you're going to see more and more counties join, and I think what you're seeing is, which it's just like anything else. You see it in all these curves. You'll see it in, perhaps I hadn't seen Phil's stuff, but you probably see it in that, and you saw it on that curve last night. With each day that we wait, more people ultimately will die. We lost our fourth person today. We may have lost more, but that I know of. We lost our fourth person today, and that is 2 in the last 24 hours. And we have posters, but I don't know how on earth you're going to hold it up and have 6 feet of distancing.
On there.
Huh?
You have some text, Judge?
Yeah. Do what now?
You have some text there?
Oh, sure. And now let's go back to that question. Phil's run some conservative models for you, and this is just for Dallas County. So COVID Act Now is a national, it's not us, that's a national consortium of scientists that put up that web page. Here's some Dallas County numbers that are at their worst about half as much infection as what COVID Act Now says.
You would agree that COVID Act Now is an extreme projection from the models that you've looked at?
I would say what would be fair to say it's a worst case scenario similar to what they're seeing in Italy.
So, yeah, this is actually, okay, I guess people were saying 70% infection had a problem with that as being higher. So this is conservative. Say the math is really easy. What this is you can see this is specific to Dallas County now. The Dallas County population broken out into different age groups. Total population about 2.6 million. So these are the age groups. If you say 40% of the population is infected, if people didn't like 70%, 40%. So this is the number of each of those age groups. You'd have 1,034,000 persons in Dallas County infected, if 40% were infected. So if, again, 40% infected, 1,034,000 people in Dallas County infected. We know the estimated case fatality rate for each age group. We've said persons over 80, it's almost 15%. Persons 70 to 79, 8%. Persons 60 to 69, 3.6%. You just do the math of those fatality rates by the population in each of those age groups for Dallas County, and you get the expected number of deaths in each of those age groups, and you add it up, it would be 13,603 deaths in Dallas County. Now you can also say, so this is the number of persons infected in Dallas County, 1,034,000. We said 80% of people are going to be well. Now a conservative estimate, we're actually saying 15% of persons who are infected go to the hospital. If we're conservative and we say just 7.3% of this percentage of the number that's infected go to the hospital, well, that number is 75,000 people in Dallas County that are going to the hospital. Now, the number of hospital beds, this was as of last Friday, that are available in Dallas County are 3,922 non-ICU beds, 416 ICU beds. We're saying there would be 75,000 persons needing to be hospitalized, and we've got 3,922 regular beds, 416 ICU beds, and so that shortage in beds is 71,000 beds in Dallas County. This is not complicated math. It's pretty straightforward. This is what we're trying to prevent. Now, if we do shelter in place, this is where the goal of that and that chart we showed comparing prevalence, we're trying to get with shelter in place that only 2% of the population is infected. So again, you've got the age breakdown. Here's the total population. 2%, this is a 20% one. I'm sorry, we've got another one. Is this 2%? Okay, so this is 2%. There was a typo, sorry about that. So this is 2% expected infections. Let me make sure. Yeah, so 2%. You've got 517,000 infections. Fatalities, you'd be down to 6,803. And 7.3% of the 517,000 persons that are infected being hospitalized, it'd be 3,776. So we actually have more beds in Dallas County that can handle this 3,776. And so we actually have an excess number of beds of 562. So this is the straightforward math. Those are the assumptions, but those are the number of beds we currently have available. This is the number we need. If we get it down to 2% prevalence in Dallas County, our hospital system and the number of beds can have it. If instead 40% of the population gets infected, that's what the data show, and it's conservative. Some of the estimates are 15% might need hospitalization. We're saying 7.3% being hospitalized. There's a huge gap, and that's what we're trying to protect.
Doctor, how long is this playing out over? You're talking about 75,000 hospitalizations in what period of time?
So that's a point in time sort of estimate, and so, that's where we'll look at how that actually plays out. This is a simplified model. I don't want to, because the models actually look at, you can do more in terms of the number of people that each person infects and model it a little more complicated. This is the simplified based on the percentages of those that are hospitalized. So that number, but it clearly overwhelms the hospital capacity, no matter how you spread that.
And if we are able to keep it to a 2% infection rate when we have shelter in place, won't it just spread and explode again when we come out of shelter in place? Or is the assumption that this is sort of...
That's exactly why we need to, and some of the models in terms of how we continue to deal with that are important. we're hoping, I mean, we are going to need a vaccine to get people protected. And that's a good point. Now, so that's, what we're dealing with.
So given the tight,
Will we doing this until there's a vaccine, or?
Some of the models, and we're still learning, we're trying to delay it. We're trying to delay this and stretch this out as long as we can. Things are continuing to change. We need to delay this process as long as we can. We'll see how things are going. There are different, there are other strategies that have been, once the testing capacity, once we have more PPE available, then there's talk about doing more widespread testing and then really focus on concentrating and containing and suppressing any clusters, that some of the clusters occur more in families and things, that if we get that widespread testing capacity, we can do more of that. That's some of the other things that are looked at in terms of strategies, how we deal with it.
so if it's not the best case scenario or the worst case scenario, what steps are being taken right now to convert abandoned hospitals or hotels, motels to ICU beds or other medical facilities?
So we are working on that constantly. Peter Urbanowitz, who was the chief of staff for the Secretary of Health and Human Services for President Trump up until about 6 months ago, is working with us. He's a friend, and I asked him to come. He's working without pay, and he's a patriot, and we appreciate his work. But he asked me to green light the opening of a hospital. I don't want to say which city facility that is in until that city says yes, but we have asked a city to convert a building, and we will provide the hospital with our federal partners what's called a RAC, through the RAC. Basically, we're going to set up a military hospital inside what is essentially a large parking garage. That is the first of many. We're looking at buildings. I've got a team that goes out, and they're looking at every shuttered hospital, every building. People have asked me about Old Parkland. We're looking at Old Parkland, not the fancy building on that is 100-year-old Parkland, but the one that is across the street from the current Parkland plant. There's other hospitals as well. We're in negotiations on those. I don't think it would be appropriate to list them until we get an agreement from people. Dr. Casanova wanted to add a point to what Phil Wong said a moment ago, or Dr. Wong said a moment ago.
Yeah, I just want to make one really brief point and take-home message. You watching at home is what drops 40% to 2%. It's not we physicians. It's not our treatments that we have. It's all of us in our community. That's what changes the 40%. This isn't the virus acting differently or behaving itself in this scenario. This is us behaving ourselves, staying at home, distancing, that can prevent that virus from hopping to a new host and to another host and to another host. So we can't emphasize it enough. The numbers display what our capabilities are as a society.
I'll make another point too. There are a lot of people that are hurting out there, and they may look at these and they may say, well, it's only a few thousand different if it's the conservative, rosiest model. Is it really worth it if it's only a delta of whatever that is, 7,000-8,000 lives? The answer would be yes, of course it is, all right? But also I want you to remember this. When the hospitals are overrun with people with COVID-19, when our healthcare heroes are down and isolated from COVID-19, and you go to the hospital for other life-saving treatment, there will be no bed for you if we don't act as a region immediately to shelter in place. So you don't have to be needing a hospital bed or emergency care for COVID-19. You just need to be needing it to be in dire trouble in less than 40 days. Any other questions, or do y'all want to play a fast round of who's opened, who's closed? Law firms, okay? I've had a lot of law firms, and I guess that's the nature of lawyers, and I am one. But if you support an essential business, then your office can stay open. If you perform some constitutionally mandated function and you cannot do it from home, like something regarding some criminal trial that must go on, then you can use your office. Otherwise, you're telecommuting. You're not an essential service. All right. So, police yourselves. You know who you are, and other people in your field police those folks who try to make their folks work. Same thing with every other type of service company. If you look on the list and you're not providing service for an essential service like healthcare or the food supply chain, then you're not covered in the order. Any last questions or stump the band or fast questions about who's in, who's out before we get out of here?
I just wanted to ask one question because
Yep.
you referenced that you have heard those comments about people saying that it's just the difference is a matter of a few thousand lives. You said you've lost sleep over these decisions. How does it feel? It seems so callous, like some of the comments that are out there about, hey, let's just let this play out and it's just a few thousand lives.
Well, people are hurting and people are panicked, people are afraid, and I think what's important is to have grace towards those people, and I respect those viewpoints. But the job of government, the first job of government, is to protect the safety of the people that they serve. That's job one. Nothing else matters if we can't keep you safe, okay? And so that's what we've got to focus on. And the job of this community is to come together with love for one another, do the right thing for yourself and your family and everyone else, and help us to defeat this invisible enemy. Thank y'all.
Hey, Judge, thank you very much. I appreciate that. Hey, no, oh, you're good. You're good. The Trump administration, your buddy, would he be open to talking about? Can I text him or something? Get his contact? Or how?